Rheumatic and musculoskeletal disorders, or RMDs, are a leading cause of ill health and loss of earnings. In Europe, it is estimated that over €240 billion are lost each year to the problem. But this issue doesn't just affect Europe. Workers throughout the world are being hit by RMDs, and every country is seeing an effect on lost GDP.
RMDs are a cause for absenteeism, for sickness leave, and for suffering, and especially for people which are at young age. They're not able to contribute to their families, to the society. They are not able to attend their initial work. And it is extremely important, first of all, to start doing analysis and collecting statistics to know exactly the scope of the problem and to have a solution that is really tackling the core of this very neglected area, RMDs.
As part of the drive to collect more statistics and to analyse the problem of RMDs in more detail, Stephen Bevan of the Work Foundation, which carries out all the research for Fit for Work, explored the extent of the issue in Russia.
The Fit for Work report in Russia is looking at the burden of rheumatic and musculoskeletal conditions in the working age population, and it looks at the extent to which we can do more to keep people with those conditions active in the labour market, active economically, and contributing to Russia's ambition for greater economic growth and competitiveness. Rheumatic and musculoskeletal conditions represent a very significant cause of sickness absence from work and lost productivity. In fact, some studies suggest that it's third only behind cardiovascular disease and cancer. Back pain in Russia accounts for about 57% of all chronic pain in the Russian population and has a significant impact on temporary work disability and sickness absence from work. Another thing that we find very common in Russia with people with musculoskeletal conditions is their risk of developing mental health problems. We call this a comorbidity. Even with conditions like back pain, people's depression or their anxiety about their pain can be a bigger barrier to their return to work than their physical health. The Fit for Work report in Russia makes a number of recommendations aimed at different stakeholders. I'd highlight perhaps 3 or 4. The first is that we need to prioritise early intervention. The earlier people are diagnosed, the easier it is to give them an appropriate intervention. That may be a healthcare intervention or a workplace intervention. The second recommendation is about joined-up action. Rheumatic and musculoskeletal conditions in the workforce is not just a health problem or an employer problem or a social welfare problem. We need joined-up action to make sure that early interventions are prioritised, that people are allowed to stay in work for as long as possible, or if they've lost their jobs, to get back into work as soon as possible too. And so we're calling for the Russian government to think about setting up a national plan so that action can be better coordinated. Another recommendation is that we need to begin to see work as a clinical outcome. We know from the evidence that by and large, good work is good for people's health, and if doctors and medics who are seeing patients with rheumatic and musculoskeletal conditions regarded work as a realistic outcome for those people, then not only would they derive health benefits, but they wouldn't have to lose their income from losing their work. So we need to think about work as a clinical outcome of treatment. Finally, one of our major findings was that we feel that employers in Russia could play a more proactive role in helping prevent rheumatic and musculoskeletal conditions from occurring in their workforces. And this is about job design, the way work is organised. Early intervention is cost effective, and so we need to deploy all our resources to make sure those early interventions are available to everybody.
The Russian report into RMDs reveals the depth of the problem and also suggests potential solutions. Only by sharing best practice and working together in truly collaborative ways can this issue be identified, confronted and tackled collectively.
I'm very pleased to welcome the Russian participants and Russia in joining Fit for Work, because I know very well from my personal experience how valuable and how good are the Russian experts, especially in the area of workforce healthcare.
Fit for Work began in the UK in 2007, has now extended to the European Union and beyond, and it's fantastic that we've got Russia as part of the Fit for Work family, which now includes Australia, New Zealand, Canada, Japan, Korea, and so Russia really adds some weight to the evidence base that we can now talk about in terms of rheumatic and musculoskeletal conditions.